Did you know that roughly 1 in every 10 adults in the U.S. develop kidney stones at some point in their lives? They usually form when minerals and salts in urine crystallize and stick together, causing blockages in the urinary tract. But what triggers the formation of kidney stones in the first place? In today's episode, let's explore the top 10 causes of kidney stones and how to avoid them or prevent them from forming. Without any further delay, let's begin. Number 1. Low urine volume. One major risk factor for kidney stones is a consistent lack of urine volume. This can mainly be due to dehydration, caused due to sweating excessively from intense exercise, working or residing in a hot environment, or not drinking enough fluids. When there is less water in urine, it becomes concentrated and looks darker in color. Highly concentrated urine indicates that there is less fluid available to dissolve salts, which can lead to the formation of stones. To reduce the risk of developing kidney stones, it is recommended to increase fluid intake, especially water, which can dilute the salts present in the urine and can effectively prevent the formation of kidney stones. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Unhealthy diet. Another common cause behind kidney stones is unhealthy diet choices. If you are taking too much calcium in your diet, it can increase your chances of developing kidney stones. But this doesn't necessarily mean that reducing calcium intake in your diet will actually prevent them. Eliminating calcium from your diet completely can have a devastating effect on your bone health. But don't worry, there is a solution. Having high amounts of calcium is often a sign that it's not getting absorbed by the bones, and that can be due to the deficiency of certain nutrients in the body, especially vitamin K and vitamin C. Vitamin K plays a crucial role in activating osteocalcin, a protein involved in bone formation. Without enough of vitamin K or this protein, calcium may not be properly absorbed by the bones. Vitamin C also plays a similar role, as its deficiency can directly impact the formation of collagen, the protein mainly responsible for bone structure. In short, if you are having too much calcium in your diet or have a deficiency of essential vitamins and nutrients, like vitamin C and vitamin K, it can potentially lead to a high concentration of calcium in the blood, and consequently a high risk of developing kidney stones. Another major risk factor for kidney stones associated with diet is the excess consumption of salty foods. High sodium intake can cause the kidneys to excrete more calcium in the urine, which can combine with other substances to form kidney stones. Therefore, it's very important to keep an eye on your salt intake and ensure you are getting enough vitamins to avoid the risk of developing calcium-based kidney stones. Number 3. Certain bowel conditions. Certain bowel conditions and surgeries can increase the risk of developing calcium oxalate kidney stones. For instance, certain conditions that cause diarrhea, such as Crohn's disease or ulcerative colitis, can lead to a significant loss of fluids from the body, leading to concentrated urine. Additionally, certain bowel conditions, including inflammatory bowel disease, and certain intestine surgeries can cause the intestines to absorb more calcium and oxalates from foods, including healthy ones such as Swiss chard, kale, and even spinach. This may lead to a high concentration of calcium oxalate in the urine, leading to a high risk of developing kidney stones. Therefore, individuals with inflammatory bowel conditions and intestine surgeries should closely watch their calcium and sodium intake and take necessary steps to avoid the formation of kidney stones. Number 4. Obesity. Obesity is a significant risk factor and one of the top causes of kidney stones. Being overweight or obese is associated with the excretion of high amounts of oxalates in the urine, and it can be even riskier if obese individuals do not drink enough water. Additionally, obesity is often associated with other risk factors for kidney stones, such as high blood pressure and type 2 diabetes, which can further increase the likelihood of developing stones. Therefore, maintaining a healthy weight through proper nutrition and regular exercise is crucial for obese people to reduce the risk of developing kidney stones. Number 5. Certain medical conditions. Several medical conditions can increase the risk of developing kidney stones. One such condition is an abnormal growth of the parathyroid glands, which play a vital role in regulating calcium metabolism. When these glands malfunction, they can cause high levels of calcium in the blood and urine, leading to the formation of kidney stones. Additionally, distal renal tubular acidosis, a condition in which there is a buildup of acid in the body, can increase the likelihood of developing calcium phosphate kidney stones. Certain rare inherited disorders can also make you more susceptible to certain types of kidney stones. For example, cystinuria is a condition in which there is too much cysteine in the urine. It can lead to the formation of cystine stones. Another rare disorder is primary hyperoxaluria. This condition involves the liver producing an excessive amount of oxalate, which can result in the formation of oxalate stones. Number 6. Certain medications. Certain medications and dietary supplements can increase the risk of developing kidney stones. For instance, certain diuretics and antacids containing calcium can elevate the levels of calcium in the urine, increasing the risk of calcium stones. Additionally, high doses of vitamin C supplements can be metabolized into oxalates by our body and can lead to the formation of oxalate stones. Therefore, it is important to inform your healthcare provider of any medications and supplements you are taking, as they can be one of the major causes of kidney stones. It is equally important not to stop taking any medication or supplement without consulting your healthcare provider first, as abruptly stopping certain medications can also have harmful consequences. Number 7. Family history. If you have a family history of kidney stones, your risk of developing stones may be significantly higher compared to those without such a history. This increased risk may be due to a combination of genetic and environmental factors that are passed down through families. Research has shown that certain genes may affect the way the kidneys handle minerals, like calcium and oxalate, and that can contribute to stone formation. Additionally, family members may share similar dietary and lifestyle habits that can increase their risk of getting kidney stones. If you have a family history of kidney stones, it is important to speak with your healthcare provider about ways to prevent stone formation. Your health expert may recommend lifestyle changes, such as increased fluid intake and dietary modifications to help reduce your risk of developing kidney stones. Now let's have a look at some of the most effective ways to avoid kidney stones. Number 1. Stay hydrated. Drink plenty of water and other fluids throughout the day to keep your urine diluted and flowing freely. Your body is pretty good at signaling you whenever it needs water, so watch out for thirst signals. Number 2. Maintain a healthy diet. Focus on a balanced diet that includes plenty of fruits, vegetables, and whole grains. If you already have symptoms or risk factors of kidney stones, try to avoid high amounts of salts and high oxalate and high calcium foods. Number 3. Limit your intake of soda and sugary drinks. High intake of these beverages has been linked to an increased risk of developing kidney stones, kidney inflammation, and several other health issues, so try to avoid them as much as possible. Number 4. Exercise regularly. Regular exercise can help keep your weight under control, which is important since obesity is a risk factor for kidney stones. Exercise can also help reduce your risk of developing high blood pressure and diabetes, both of which are associated with an increased risk of kidney stones. Number 5. Avoid consuming caffeinated drinks and alcohol too much. Being diuretics, both of these things tend to cause dehydration in your body, which can increase your risk of developing kidney stones. By incorporating these strategies into your lifestyle, you can reduce your risk of developing kidney stones and maintain overall good kidney health. Thank you for watching and subscribing to the channel. See you in the next video.